Introduction to Pulp Pathosis. Hello and welcome to another session of Endodontics. Before we begin, I have a question. Do we remember what was called one of the most painful experiences, almost like the pain of a heart attack? Yes, you are right. Tooth pain is one of the most painful human experiences in the world. So don't you think as dentists, we have the prime responsibility to treat a patient who comes to us with a toothache? With this, let's dive into today's topic of discussion, which is diseases of the pulp, or pulpal pathosis. As we are aware from our extensive oral histology lectures, the pulp is an integral part of the tooth as it is a formative organ. It helps in building the primary dentin during tooth development, secondary dentin after eruption, and also in the formation of reparative dentin. As much as it is considered a highly resistant organ, it has little resistance or healing ability. When there is any injury to the pulp, all measures are taken to ensure it is saved. Now, why should we attempt to save the pulp? Well, it is because pulp is what keeps our tooth alive. It is the soul of our tooth. Without pulp, we would be unable to realize if we are biting on an almond or an iron nail. To detect the changes in the temperature of our foods and drinks would become impossible. Pop quiz. Hence, to treat something that is not well, we first need to understand the pathophysiology behind the disease and how it presents itself. So, what do you think can hurt the soul of the tooth? Let's now discuss the etiology behind pulpal disease. These can be majorly classified as physical, chemical, and bacterial. The physical causes can further be subdivided into mechanical, thermal, or electrical. I know it might sound a little hard to remember now, but let's make it simple by beginning with the physical causes, under which the first factor is mechanical. The mechanical causes include trauma, pathologic wear such as attrition, abrasion, crack on the tooth, and barometric changes. Does the term barodontalgia sound familiar? Well, if yes, then let's answer this question. Pop quiz. With this, let's move on to the second physical factor, thermal changes. We earlier talked about how pulp can detect thermal changes. But what happens when these changes are extreme, such as heat from tooth preparation, exothermic heat from setting of cement, conduction of heat or cold through the restorative material, and frictional heat due to polishing? These also contribute to pulpal disease. Pop quiz. Apart from the mechanical and thermal causes, let's also learn more about the third physical factor, which is electrical. Sometimes galvanic current formed due to dissimilar metallic fillings can irreversibly damage the pulp, leading to pulp pathosis. Alright, So these were the three physical factors. Let's now discuss the chemical and bacterial causes. Although not commonly seen, chemicals such as phosphoric acids used during restorations or wasting diseases such as erosion can also cause a diseased pulp. Therefore, what is the most common and well-researched cause of pulpal disease? Yes, it is the bacterial cause. Toxins associated with caries or direct invasion of pulp from trauma can lead to pulpal pathology. The presence or absence of bacterial irritation is the determining factor in pulp survival once the pulp has been mechanically exposed. Pop quiz. Now these causes can unlock a series of pathways to which the pulp responds differently as seen here. A healthy pulp can react to noxious stimuli to cause inflammation. This can lead to reversible pulpitis, which means the pulp can reverse to its healthy state on withdrawal of the stimulus. However, if the stimulus continues to irritate the pulp loses all hope and becomes irreversibly inflamed. This is where irreversible pulpitis sets in. Irreversible pulpitis can be symptomatic or asymptomatic. It can present as chronic hyperplastic pulpitis or a case of internal resorption. From here on, the pulp gets necrosed, or in other words, the soul leaves the tooth. Now let's try to correlate. Do you remember a patient who reported intense pain from a decayed tooth that lasted for a few days and then abruptly eased without the use of medication? Well, that is a typical example of symptomatic irreversible pulpitis becoming asymptomatic. We also encounter patients who say they have never had a painless carious tooth for 1 year, but suddenly developed severe pain. Well, can you guess what happened here? Yes, the asymptomatic irreversible pulpitis became symptomatic irreversible pulpitis. Sometimes the noxious stimuli can harm the healthy pulp so severely that it can lead to necrosis of the pulp. At other times, pulp can react differently and degenerate, which is calcific, atrophic, or fibrous in nature. Now that you know the different ways that pulpal disease can present, you can start identifying them in patients around you. Let us conclude our topic for the day by recapping some important points. 3 major causes of pulpal disease: physical, chemical, bacterial. Clinical classification of pulpal diseases: inflammatory, reversible, irreversible. Pulpal degeneration: calcific, atrophic, or fibrous. Pulpal necrosis. In our next video, we will discuss the details of the different pulpal diseases. We hope you had fun learning with us.